member, Professor Murray Vimy, founder of the International Academy of Oral Medicine and Toxicology. Dr. Vimy is in private practice in Calgary, Alberta. He's an associate professor, Department of Medicine, Faculty of Medicine at the University of Calgary. He has a number of publications of research studies to his credit in peer-reviewed medical and dental scientific journals. Dr. Vimy has lectured extensively both in North America and internationally. He's a member of the 1990 Expert Committee on Mercury Toxicology of the World Health Organization. He's widely esteemed internationally for his expertise on dental amalgam mercury. And of great importance to us, Dr. Vimy was, again, the founder and the first president of the IAOMT. Thank you very much, Dr. Vimy.
We have a special event here today. Actually, it's a little different than what was written up in the brochure, but I think you'll find that it does fulfill the requirements of the original title. I've managed to pry a professor of dentistry to debate me today. He doesn't know that yet, but it is true. So today is the debate that the ADA does not allow, because since 1981-82, slightly after that, no dental professor will debate us on the scientific merits of dental amalgam. You know, that's one of their strategies. So our guest today for this debate is Dr. Stephan C. Bayne, who's the section head of biomaterials and operative dentistry at the University of North Carolina. In 2004, he was president of the IADR, International Association of Dental Research. And in 1999 to 2000, he was president of the AADR, the American Association of Dental Research. His educational background is he has a BA in biology. He has from Northwestern University a master's and a PhD in biomaterials. He has published hundreds of papers. He's published many educational things for dental students, and he's well regarded in the dental establishment. Interestingly enough, his clinical research was funded by some of these companies, most notable LD Koch Dentsply, makers of spherical alloy and dispersal alloy, and Kier Cyberon, makers of a number of amalgam substances, as you can see here. So he has a history with industry, with education, with science. He's not a dentist, he's not wet-fingered, he's a PhD bioengineer.
The mercury or amalgam controversy is a public discussion about the relative safety of dental amalgam restorations due to the inclusion of mercury in the metallurgical structure of the material. It has changed in quality and intensity over the years, but continues even today. There are numerous websites devoted to coercing patients, dentists, or scientists towards one side or the other of the issue. For the current presentation, the goal is to present the science available and the key information for potential discussions of issues with patients.
That was the voice of Dr. Stephan Bayne. This particular presentation was uploaded or downloaded or filtered from the University of North Carolina Faculty of Dentistry website. So you will be hearing his opinions in his voice. And to start out with, he's already indicated that there's a lot of coercion going on in this particular debate, and that he is about to present to you the scientific information.
Quickly, let's review the status of mercury. Everyone has had the experience of playing with small droplets of mercury from a broken thermometer or in a lab or whatever. One of the impressions that sticks with you is how easily the droplets tend to coalesce together when they touch each other. What you tend not to remember is that the droplets are also easily broken up into smaller and smaller ones. There's also a very high vapor pressure associated with mercury, and the gas is invisible. The picture to the left is of a mercury mine worker from South Africa. He's actually sitting on a vat of raw mercury. Because the density of mercury is so high, he tends to float. Once he gets down off the vat, his pockets and cuffs are filled with small droplets of mercury that easily penetrated through the holes in his clothing. In set dental amalgam, the mercury which was mixed with the alloy resides only in the matrix phase, predominantly silver mercury. It is not in the particles of unreacted alloy. The matrix melts at about 128 degrees centigrade, and so just above the boiling point of water. You can actually melt dental amalgam and release mercury from the matrix phase very easily. In most cases, when amalgam is being polished, small amounts of heat melt the surface, smear the mercury-rich layer around, and give a mirror-like appearance. Remember that old mirrors were actually a coating of mercury with silver on the back of a piece of glass. Once mercury is released as a vapor, it can be breathed and absorbed into your system. Persons who are exposed to mercury vapor may display a toxicity or sensitivity reaction. Vapor limits, or in other words, TLV, or threshold limit values, for toxicity are set by the Industrial Hygiene Group and are established at 0.05 milligrams per cubic meter as a safe upper limit. This is equal to about 50 micrograms per cubic meter, and these are the more common units for reporting mercury in dentistry. The level is extremely small, equal to about 5 parts per billion, but it's still relatively easy to stay below that level. Sensitivity is extremely rare and very low in terms of absolute level. Allergic individuals do not go into anaphylactic shock. The ADA estimates that fewer than 1 person in about 100 million are actually involved. In the U.S., that translates into only about 2 or 3 people. Therefore, there's no practical worry for anybody in dentistry in this regard.
Oh, but Dr. Baynes, what have we learned here? We have learned that it's okay to play with mercury and get it into your pants. We've learned that it's okay to sit on mercury, and we've learned that it's okay to make mirrors. This is a typical ploy used by these people to denigrate and demean and make small the problem with mercury. His presentation up to this point had a lot of factual information about mercury released. They agree with us that mercury is released. What they argue about is how much. And they choose threshold limit values set by government agencies as the standard for safety and non-safety. And the American Dental Association has decided on its own, without research, that only 1 in 100 million Americans are allergic to mercury. Well, that's not the case. What you were not told by him is that you don't have to boil an amalgam to release the mercury. We all know this. All you have to do is chew on some gum. All you have to do is rub the surface with an Explorer. Mercury freezes at minus 38 degrees centigrade and it boils at 356 degrees. Yet, if you have a droplet of mercury on the floor at room temperature and come back 2 weeks later, it's gone. It's gone because it vaporizes. For every 1 degree of temperature above room temperature that you raise the mercury, it increases its vaporization rate by 10%. You put a block of lead on the floor, you come back 2 weeks later, the block of poisonous lead is still there in its entirety. You put the same volume of mercury on the floor and you come back and it's gone. Where did it go? So, you do the mathematics. If it's vaporizing at room temperature and is gone within 2 weeks, what happens in a mouth at 37 degrees C? What happens in a mouth with hot coffee? What happens in a person who chews gum all day long? Those are the questions that they dodge and the misinformation that they put out. Well, he talked about the standards. He talked about the TLV. But you see, there are a number of standards that have been set. Occupational Safety and Health Association has a permissible exposure limit. That's a limit that cannot be exceeded, even briefly, and that is 0.1 milligrams per cubic meter. NIOSH, National Institute of Occupational Safety and Health, in 1992 recommended an exposure limit of 0.05, which is the one that he likes to choose. And that was for workers who worked for 10 hours a day for a 40-hour work week. But workers know they're exposed to mercury. They are tested regularly. They wear protective clothing. They usually wear breathing masks. So to apply that standard to average people in the community is false, misleading, and improper scientifically. The American Conference of Governmental Industrial Hygienists in 1994 put out a TLV of half of the NIOSH one of 0.25 milligrams per cubic meter, and that was for an 8-hour day, 40-hour work week. So who's right? Which standard is right? Well, interestingly, the US EPA, Environmental Protection Agency, has a standard for the mercury concentration in the air of Las Vegas, and it's not to exceed 0.001 milligrams per cubic meter, because in the general community, there's sick people and healthy people. There's big people and small people. There's babies. And you want to be safe for everybody. There's genetic differences. There's genetic susceptibilities that can be out there. So why doesn't he choose this standard? Is he being honest? Is he being scientific? Is he being reasonable to pick the highest standard to say that amalgam is safe? He should be picking this standard, which is 0.1 parts per billion, and that's for a 24-hour day, not an 8-hour day. So I put it to you, there's a little shenanigan going on here. The American Dental Association did sensitivity calculations. Well, let me tell you, we know how they came up with it. In 1974, there was a meeting, and the American Dental Association was part of it. The steering committee came out afterwards and said that, 1 in 100 million people are sensitive to mercury. And they were asked, what was your data? Because this is a scientific question. This isn't, does God exist? This is a scientific question. What was their data? They had none. It was the opinion of their authorities. The opinion of their authorities. Well, the North American Contact Dermatitis Group, prior to that, these are 13 dermatologists across North America, did a randomized control study where they did mercury chloride patch tests on a variety of people. And they found that 5% of the population showed a positive reaction. So I put it to you. Is he being honest? Is he being scientifically accurate? Is he being correct? When the data is there in the medical journals. Now remember, he's not a physician, he's not a dentist. He's a biomaterials engineer.
Mercury exists in 3 basic forms: the elemental form, or pure mercury, the inorganic form, which is principally cinnabar, or mercuric sulfide, as it's found in nature, and the third form is organic mercury, primarily as dimethylmercury for its use in farming as a fungicide or herbicide. These forms are convertible, but not necessarily in a practical way. Absorption into the human body occurs via the skin, the lungs, or the gastrointestinal tract. These routes are very unequal in transport efficiency. For all practical purposes, mercury is not quickly absorbed through even clean skin in any form. Elemental and inorganic mercury are readily absorbed across the alveoli in the lungs into the blood, but only difficultly absorbed in the GI tract. Organic mercury is not practically absorbed in the lungs at all, but is readily absorbed in the GI tract. In other words, mercury from amalgams that's released into air in the mouth can be breathed and directly absorbed, but mercury mixed in saliva and swallowed is practically not absorbed at all. Organic mercury that is a contaminant in almost all food is readily absorbed. All people have been detected as having some circulating mercury in their systems from the food that they eat. This probably represents greater than 99% of the body burden. Because the mercury is actively excreted, there are never any symptoms of mercury toxicity that develop.
Well, what do we know for sure? He said that most of the mercury in the human body comes from the food source. Is that a true scientific statement? And the answer to that is absolutely not. It's false. Autopsy studies in Sweden, Germany, and the United States of people who died in car accidents showed that the mercury content of the various organs in their body correlated with the number and types of amalgam fillings in their mouth. If you had a lot of amalgam fillings, you had high mercury burden in your tissues. If you had no fillings, you had virtually none, except for a background. So that's one set of scientific data. And this data was published, some of it, in dental journals. This is not new information. This goes back a couple decades already. Dr. Vasaposian at the University of Arizona did a study on live human beings where he took urine samples from them, then he challenged them with a chelating agent and took a second urinary sample, and he found that greater than 2/3 of the mercury excreted was from dental amalgam, because he had 2 groups of people. One group with amalgam and one group without amalgam. The people without amalgam, the before and the after mercury urine levels were identical. The people with amalgam showed a 3-fold increase in mercury excretion. So is our scientific friend from the University of North Carolina being honest? Is he being forthright? Is he being correct in delivering facts? Now remember, these slides and his voice are on the site of the University of North Carolina. He is putting out in continuing education and to the dental students false information, in my opinion. False facts. Facts that don't jive with published peer-reviewed journals.
The complex routes of absorption, migration, distribution, and excretion are summarized above. Assaying the mercury in blood or urine or hair does not reveal the original source of the mercury or the time of absorption. On average, the half-life of mercury circulating in the body is about 55 days. Therefore, whatever mercury is measured should be related to the exposure that primarily would have occurred over the last 2 months. Mercury is released from dental amalgam, but in very small quantities. Remember, the recommendation for exposure is that one stay below an average of 50 micrograms per cubic meter for a 40-hour work week. Below that level, there are no known health effects. Above that level, small changes can be detected. Yet until the level is 5 to maybe 20 times that limit, most symptoms are very mild and reversible. In dentistry, it's very simple to stay well below the 50 micrograms per cubic meter level. For a patient chewing on amalgams, it's possible to put mechanical energy in that's converted into sublimation energy. Mercury along the amalgam surface is then released in very tiny amounts. When you stop chewing, the vapor pressure for solid quickly drops almost to zero. One of the tricks for anti-amalgamists is to have a patient chew, keep their mouth closed to concentrate the sublime mercury vapor, and then measure the concentration. Under these conditions, it's possible to accumulate enough mercury to actually produce measurable amounts. If you monitor the change over time in a patient's closed mouth, it looks like the light blue curves. However, this information is of no real value. Patients only chew about 1% of the time. Any released mercury is mixed with saliva and swallowed, not inhaled, and therefore the real exposure is minuscule.
Did you catch this? This particular comment is inaccurate, it's false, and it's defamatory. These lines that he's talking about are from a study I published in the Journal of Dental Research. Not the American Dental Association Journal, the Journal of Dental Research, where we gave people gum to chew, and every 5 minutes they would spit the gum out, swallow, open their mouth wide, and we take an intraoral mercury vapor reading in an open mouth. Remember, he said the anti-amalgamists, and that means us, we try to trick people because we take a measurement in a closed mouth and somehow that's bad. Well, that's a lie. He said that if you did that, you'd get the blue line. That's not true. That's not how it's done. That's not how it was written up. That's not how it was published. That's not how it was peer-reviewed. That's an outright false statement, a defamatory statement. Mercury released from the filling rises for 30 minutes, and he drew this himself. Thereafter, it actually plateaued. So if you continued to chew, you'd stay at that level. So if you're a gum chewer and you chew all day long, you're up here. Now, these curves are averages of samples of people. So there are some people who had very high readings way off the scale and some people that are low. So for him to then bring in this TLV and say, see, everybody is safe, is a totally fallacious argument. You should know this and understand this. Because this is the crap that you're going to be exposed to by your colleagues, because they buy into this crap. They're crap collectors. These people down here are people with very few amalgam fillings. Less than 5, I believe it was. It's been so long since I've done the study. And he also made the false statement that he said that below 50 micrograms per cubic meter, there are no symptoms. But what do we know for sure? He said that there were no health effects below 50 micrograms per cubic meter. All right? Yet the World Health Organization, of which I was a member of their expert committee, has come out and said on a number of times there is no known safe level for mercury exposure, none. The more you're exposed to, the worse it is, and there are biologically susceptible people in the population. The best course of action is to minimize the risk wherever possible. That was the recommendation of medical experts. And although I'm a dentist, I function out of a medical school, and I published my paper with medical colleagues. And I certainly don't take credit for all the work, but they have a lot higher standard of science than this guy seems to have. He said that the release from the amalgams is tiny. It's not so tiny. It's constant all day long. And if you're a nighttime tooth grinder, and I'm sure all the dentists here have seen this, you've seen some of these amalgams worn flat and glassy, with a glassy surface. Where's all that mercury going all night long? You think it's being blown off into the stratosphere? I used to give a lecture, it used to be called Where's the Wear? And for those of you who haven't heard it, if the tooth is wearing down and the filling is wearing down, where is the wear going? It's got to go somewhere. And he also said that the mercury vapor drops back to zero quickly. Well, that's not true. As you can see, it rises up and it slowly drops, and actually if you extrapolate this, it takes 90 minutes for it to go down. This is a 30-minute chew. Breakfast, 30 minutes later. Snack, 30 minutes or a few hours later, lunch. You know, another hour and a half later, another snack. People are on a roller coaster of mercury vapor exposure just from chewing. So he demeans the whole process of this by saying that tiny amounts come out and it's very brief. It's not very brief. It's continuous like a roller coaster all day long. So these are things we have to think about, because what we're up against is we're up against an establishment that's trying to protect itself. He also said that below 50 micrograms per cubic meter, there was no symptoms or problems. But it's been well published in the medical journals that there's a syndrome called micromercury syndrome, low-level mercury exposure. And interestingly enough, it tends to affect the thyroid gland. And we had a speaker today talking about iodine and thyroid, and I found that whole thing very interesting. Mercury gets in there and competes. In the dental literature, it has been established unequivocally that there's amalgam-induced periodontal disease. Try it. With your periodontal patients, instead of scaling, root planing, and bleeding them to death, take out the amalgams first and watch the tissue heal. You all know, you've all been trained in oral pathology, that heavy metal poisoning causes what as an oral symptom? Bleeding gums. Not everything is bacteria and amoeba and spirochetes. Mercury leaching in directly adjacent to a filling into the tissue causes periodontal disease. And when I graduated in dental school, the big thing was gingivectomy. Those of you who are from my ilk know that that was the treatment of choice when you had bleeding gums. Do an oral circumcision. Take it all off. What were they really doing? And they didn't know it. They were moving the tissue away from the mercury. Oral lichen planus, which is a white patch in the mouth, and you quite often find this by the second molar on the cheek. You'll find a white patch right there. Can be a precancerous lesion. If you look into a mouth and see oral lichen planus next to amalgam, you are justified to take that amalgam out. That's an allergic, potentially carcinogenic response. Published, like 10 papers in peer-reviewed dental journals. All right? Oral galvanic lesions. If you have a person that keeps coming in that has mixed metals in their mouth, and they come in with ulcers all over their mouth all the time, constantly ulcers, 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 and they got all these different kind of metals, could it be a battery? Yes. You get rid of some of the bad metals, leave the gold behind if it's good, and instantaneously these people get better. A lot of burning mouth syndrome is caused by dissimilar metals in the mouth. This is good. This is documented all the way back to 1917. Cracked tooth syndrome. Even the NIDR chairman, who was a Danish guy, his name slips my mind right now, published an article in Dentistry Today where he said amalgam is not a good material because it expands and cracks teeth. It's called planned obsolescence. It's called planned retirement for dentists. Put the amalgam in, when people are 40, the teeth crack, you put the crowns on. Then they abscess and you do the root canals. Then they go bad and you pull them out, then you do the dentures. That's the treadmill. What about antibiotic resistance? Dr. Ann Summers, a fellow of our academy from the University of Georgia, worked with us and did a study. When we collected fecal material from animals, put amalgams in, and collected the fecal material again. We analyzed the material for mercury. She analyzed it for mercury resistance. Why is that important? Mercury resistance and antibiotic resistance are on the same molecule in the genome. If you're exposed to mercury, you not only become mercury resistant, you also become antibiotic resistant. And there's a big problem today, isn't there? We have all these diseases popping back. TB, that guy who went off to Russia down here and came back, we see this all the time. We're kind of worried about the Mexican community that comes up that's undocumented and maybe hasn't had the proper vaccinations and things. We don't know. And kidney dysfunction. We put amalgams into sheep and gorked their kidneys. Gorked them. Published papers. Everything here is published. Is he being genuine when he says only above 50 micrograms per cubic meter do you get a problem? I think not. Dr. Baynes, I think that you're not quite telling the truth. Ideally then, a dental material that is to be used in the oral cavity should be harmless to the pulp and soft tissues. Also, it should contain no toxic diffusing substances that can be absorbed into the circulatory system to cause a systemic toxic response. The material should be free from potential sensitizing agents that could lead to an allergic response. And finally, the material should have no carcinogenic potential. Dental amalgam fails on each of those points. And that was published in the 1982 issue of Skinner's Science of Dental Materials, which was the Bible in dental schools and may still be in many places. Not only is the mercury toxic, the tin is toxic. The silver is toxic. And the copper is toxic. Ladies, might I remind you of the IUD problem of a number of years ago. Those who can remember, they were copper IUDs that were implanted because copper is cytotoxic. So when those little swimmers came by to go looking for that egg, they got lambasted with copper ions and died. Yet the big thing in dentistry was to add higher copper into the dental amalgam. So these dental materials guys don't even read their own textbook. I had Ralph Phillips from Skinner and Phillips sit in front of me at a continuing education course where I was not a participant in giving the lecture, but it was in Calgary. I was in the audience, and I asked him. And he just looked at me and turned white.
To test the effects of eating amalgams, a recent clinical trial set out to monitor the appearance of mercury from amalgams that were ingested. With a bribe of a good grade in dental materials, the authors of the study shown above had several dental students swallow pulverized fresh dental amalgams that had been weighed into gelatin capsules. The students had blood samples then drawn over the next 90 days to monitor the blood level of mercury. Note that the scale is in nanomoles of mercury in plasma. While the first traces could be quickly detected, the amounts were incredibly small and continually dropped over the exposure as the body eliminated the last traces. Mercury rapidly dropped back down to the background levels. Measured half-lives for mercury in this experiment were about 37 days.
Okay, this is exactly the same thing as we showed in our studies. He says that 80 days is a short period of time for it to drop back down to baseline. He had dental students swallow capsules of crushed amalgam and then measured the mercury in their blood. All right, what a horrible experiment to do on these kids. And this is a one-time exposure. Well, if you're eating every day, if you're grinding your teeth every day, if you're chewing gum every day and these particles are going down with your saliva, this thing here doesn't just drop down in 80 days, it plateaus off, doesn't it? Is he being disingenuous not to think about what the repeated cycle would happen? What would happen to these students if they repeated the cycle 4 times a day, 5 times a day, every day for a year? So he used pulverized amalgam, and he said that they did not swallow vapor or gas and saliva. It was a one-time swallow. It takes 90 days in that experiment to get back down to baseline, and he didn't use radioactive mercury, so his ability to actually measure the mercury was limited by that.
Patients are more likely to encounter anti-amalgamous literature than pro-amalgam information. This is unfortunate but true. Therefore, it's very important for dental personnel to be familiar with the anti-amalgamist arguments and be able to quickly and effectively counter these in patient discussions. Hal Huggins was the original proponent of amalgam removal. In 1995, he was prosecuted by the state of Colorado for false advertisement and reckless endangerment of patients who he had been treating for life-threatening diseases and from which they did not recover. He continues to sell things from that location on the web. The details of the adjudication can be reviewed by clicking on the information in the panel above. He has since moved his office to Mexico City, where he continues to practice and promote amalgam replacement. Many others aligned with the anti-amalgamist movement are also notable. Mike Ziff is a dentist in Florida that was convinced that amalgams were bad. To increase his credibility in arguing his case, he purchased a master's degree through the mail for $3,000. His father, who was also involved, purchased a PhD for $10,000. So be careful. As far as these individuals are concerned, their degrees or their credibility may not be what they seem. Some positions of anti-amalgamists are published in scientific-looking journals or books. Roy Cupsinol is an MD who became a printer and distributor of many of these materials. These often end up intentionally integrated into the magazine stacks in a patient waiting room as a method of increasing patient questions and anxieties.
I have no comment on that because really the venom and the deceit in some of the statements made there are absolutely atrocious and speak for themselves.
Early on, there was an organization promoting amalgam replacement called the Academy of Oral Toxicology, located in Colorado Springs, Colorado, notably the same location as the home of Hal Huggins. However, it was shut down by the IRS for lack of payment of taxes. It reorganized itself as the International Academy of Oral Medicine and Toxicology and has continued to exist ever since in Alberta, Canada. One of the items that the organization touts as scientific evidence of amalgam problems is a sheep study performed by Lorscheider and Vimy. The study was rejected by 11 different dental journals as fatally flawed and unscientific, but was finally published by FASEB, F-A-S-E-B, in their journal. Since that time, the article has been assailed by every major dental and medical association involved as flawed and useless. There was an important convening of the NIH-NIDCR to consider these issues at about that same time.
Schwing, what a bunch of hot air. Oh, he's giving me gas. Well, let me tell you something. I founded the International Academy of Oral Medicine and Toxicology. It had nothing to do with Colorado. It had nothing to do with Hal Huggins. I had nothing to do with Hal Huggins except seeing him once at a course. That's a lie. Excuse me. I'm not even going to say in my opinion. It's an outright lie. Number two, we had nothing to do with the IRS. It was a Canadian organization until recently repatriating itself to the United States. Not repatriating is a bad word. Patriating itself to the United States. He talks about the sheep study. Hey, I did the sheep study with my medical colleagues. We sent it to no dental journals. He said it was sent to 11 dental journals and rejected. That's an outright, in my opinion, lie. This is a professor of dentistry. Well respected, okay? He says that all the medical groups and everybody disparages the research. No, 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 no. Nobody has disproved it. The FASEB journal, Federation of American Society for Experimental Biology, I think I got it right, is made up of 20,000 medical PhDs and researchers, doctors. American Physiological Society, the American Anatomical Society, the American Biochemical Society. All of these societies belong to FASEB. To get one paper published in the journal in a lifetime is considered an honor. We had 3. The editorial board is made up of Nobel laureates. So you know now why people like Dr. Bayne won't come here physically and debate me. Because he's done nothing but engineering research. And you should know that.
The sheep study involved placing 16 dental amalgams in a single sheep using radioactive mercury. Sheep are ruminants with 4 molars per quadrant that continually erupt and are ground down during their normal chewing. After 30 days of feeding this sheep hay, it was placed on a radioactive exposure film to track the relative distribution of the radioactivity in its body. As can be seen in the photograph above, most of the amalgam was consumed by the sheep grinding its teeth, and all that stuff ended up in its 2 stomachs. Radioactive material that had been absorbed and circulated throughout the body into various organ systems was actually analyzed by the authors. But others confirmed that the measured levels of those mercury levels in different organs were actually within acceptable limits in most cases. One of the major flaws in the scientific design was that humans obviously do not consume their amalgams like sheep and don't wear them down.
Well, what we know for sure, what about the monkeys? You see, what you'll find is that omission is as bad as commission. They leave out things that were published. These slides that he produced were done in 2004. The monkeys and the sheep were done in the 1990s. Okay? What about the monkey study? You see, because we knew what was going to happen. The dentist came out and said, oh, yeah, sheep grind their teeth, they chew, they're cut, they do this, they do that. No wonder you got mercury all over the place. That's a bad model. So we ran out and got a monkey. Teeth just like you and me. 1% of the DNA is different. There, but for you and I, we could be the monkey. We didn't give them food constantly. We fed them 3 meals a day, just like humans would be fed, and they chew just like you and I would chew. And what do you think we got, and what do you think we published in the FASB journal? You know, what about the monkeys? That's what I want to know. Dr. Bayne, what about the monkeys? There's the monkey picture. Here's the head, here's the arms, the torso, and the legs. Everybody can see it now? Say yes. All right. The radioactivity in the teeth, in the jawbone. The teeth were extracted in the jawbone. And again, you're going to find amalgam particles from the chewing in the GI tract. When you take the GI tract out, you can actually see the 2 kidneys. 70% of mercury goes to kidneys. Autoimmune glomerulonephritis, kidney disease, and kidney shutdown is a major problem today. I think that mercury from amalgam is part of the cause. But why was he disingenuous to put out a lecture and not mention the total package? I'll tell you why. Because it doesn't suit what they have in mind for dental amalgam. Other things. We did a fetal study where we had pregnant sheep. Put the mercury in, got the sheep pregnant, and then looked at the fetuses, and guess what we found? Those little bugger fetuses just sucked up the mercury, just like it did at Minamata Bay, and you heard the lecture probably from Dr. Chang. What about the breast milk study? Wayne King worked with our group and collected human samples, human breast milk, and he did an examination and found out the number of fillings, and we put mercury fillings into sheep and collected sheep breast milk. And guess what? Humans had mercury in their breast milk. That correlated with the number of fillings that they had. And the sheep were putting out the same kind of thing. Animal model, human model. Animal model, human model. Either you believe in science or you don't. And I hope some of you stay for my second lecture. Because if you believe in science, you have to stay, as they've got me staying, between the lines here so that they can photograph me. You've got to stay true. You can't pick and choose. Even his own dental study, swallowing the amalgam particles, is exactly the same as the sheep and the monkey. The mercury showed up in the GI tract. Well, what do you think? That's exactly where it's going to go.
The anti-amalgamist dentists have a relatively straightforward scam for patients.
Scam.
Be careful. This is important. They suggest that human disease is related to negative currents of electricity in the body. Typically, a patient fills out a health history questionnaire that infers that all complaints will probably disappear after amalgam removal treatment. To develop the scam, negative electricity purportedly is measured with a voltmeter by placing one lead on the amalgam and the other on the tongue. The readings recorded tooth by tooth for each quadrant. All the values in the quadrant are then summed. The most negative quadrant is tackled first, and after waiting for the patient to recover from the electrical shock of the first quadrant, which usually takes about 4 to 7 days according to the anti-amalgamist, then the other amalgams are replaced as well. For this treatment, an anti-amalgamist might charge 7 to 40 times the normal and customary fee for a restorative procedure. It's rumored that one famous anti-amalgamist charged a patient $18,000 to replace 6 posterior amalgam restorations.
All those that charge 40 times the going rate to replace amalgams, raise your hand, please. Made up. Who's the dentist? Where was it published? Did he lose his license? What's it about? Hearsay. Hearsay, folks. Hearsay. From a scientist with credentials. If you tell a lie big enough and keep repeating it, people will eventually come to believe it. It thus becomes virtually important for the state, i.e. the American Dental Association, to use all of its powers to repress dissent. For the truth is the moral enemy of the lie, and thus by extension the truth is the greatest enemy of the state, the ADA. Joseph Goebbels.
Another point of confusion perpetuated by anti-amalgamists is that corrosion releases mercury from dental amalgams. That just does not happen. Corrosion reactions for low copper and high copper dental amalgams are essentially the same and are summarized above. With low copper amalgam, the corroding phase is tin mercury, Tin is transformed to tin oxide, which is generally insoluble, or tin oxychloride, which is generally soluble. And these materials accumulate either within the amalgam or at the margins. The mercury from the original phase is quickly reacted with the residual silver tin alloy that's within the amalgam and very close to the released mercury. The mercury does not leave. In high copper dental amalgams, the corroding phase is copper tin. Tin again forms tin oxide or tin oxychloride. The copper forms copper chloride. No mercury is involved at all.
If you can't dazzle them with brilliance, baffle them with bullshit. That's all I got to say, because anybody who's ever measured mercury in the mouth knows the mercury comes out. It comes out. You hear what he's telling you? He's telling you the mercury says, oh, hey, there's corrosion going around. I better go back here. And you go right back into the old amalgam. Doesn't happen, folks. Mercury is very volatile. How do we know? Just take a look. Just take a look. But this guy's not a dentist. He's not wet-fingered. He's never touched tissue. He's never gone in there and seen what we've seen. How do you explain this? How do you pretend, with all your biochemical gobbledygook and your engineering, that the mercury somehow turns around and goes back in instead of going out? It just doesn't happen. The evidence, the visual evidence, is just astounding. Every dentist has seen it.
It's very complicated to deal with a wide range of questions that arise when patients are first confronted by the mercury controversy. Fortunately, Consumer Reports has visited the issue and published 2 separate and extremely valuable reports that are ideal to allow patients to see the issues from a neutral point of view. Consumer Reports has a very good professional reputation in the public's eyes. In both articles, they clearly condemn the anti-amalgamist view. Therefore, one should consider distributing copies of these to patients to deal with the issue.
Did you hear that? His standard of excellence is Consumer Reports. The experts on can openers, paint guns, and clothes from Japan. They're the medical experts that he tells you to take their article and send it out. Do you know who wrote the article for Consumer Reports? National Council Against Health Fraud, which themselves, they're called the anti-quack group, which themselves have been under investigation and have lost several court cases in California and across the United States. That's who he's recommending as the expertise that you should hand out to your patients. To overcome an opponent's point of view, Joseph Goebbels, Hitler's minister of propaganda, proposed the following. First, denigrate the information. I think he did a good job of trying to do that, and I hope I've disproved his points. Then attack your opponents on a personal level. Well, he attacked some people, didn't he? Went after them. And finally, appeal to your own authority. His authority, himself, the American Dental Association, and Consumer Reports. That's his authority. I founded this academy on science. Either you believe in it or you don't. If you believe in it, you have to stay between the lines. You have to stay true to the calling of science. You can't vary, because if you vary outside, you have a problem.
At this particular point in time, the profession is in an age of decreasing amalgam use throughout most first world regions. The graph above tracks amalgam use by U.S. dentists based on ADA survey data. The reasons for the decrease include a number of forces: impact of preventive measures such as fluoride and sealant use, different decisions for amalgam replacement such as longer-lived high copper dental amalgam alloys, more hesitancy to replace amalgams based on marginal degradation criteria that used to be used as selection criteria for new restorations. Composite use routinely for anterior and posterior situations, and other approaches to restoration such as CAD/CAM. The number of amalgam restorations placed as replacements of existing ones have declined remarkably. The general trend is toward amalgam disuse by the end of this decade.
This is what the establishment wants. They want amalgam to go away slowly so there's no liability, so dentists out there don't get sued, so dental schools don't get sued, so dental professors don't get sued, so the ADA doesn't get sued, so the manufacturers and the distributors don't get sued. That's what it's about. And he's claiming that these things here are the reason for the drop in the amalgam usage over time. Well, ladies and gentlemen, let me tell you, let's go up here and look straight. 1981, this academy was founded. Shortly thereafter, there's a large decline in amalgam use. In 1990, I was on 60 Minutes with Morley Safer for a half-hour segment. Some of you may have seen it. It was one of the most widely watched and most controversial segments they ever ran, next to the assassination of your then or previous President Kennedy. Another fast draw. And ever since, the members of this academy have been fighting tooth and nail to get amalgam removed. We don't want anybody sued. This is not going to end with a bang, it's going to end with a whimper. And that's the way it should be. But let's put it in perspective. They are trying to claim credit now for the amalgams not being used as much.
So be cautious and be wary of the anti-amalgam myths that are out there. Try to do your best job in terms of clearing up any questions that patients have. Good luck and thank you.
I apologize if this lecture today hasn't been as smooth as many of my lectures have been. But I wanted some people in this academy to see who they really are up against and to hear their own voice, to see the websites on dental schools at universities and what they're saying. I'm proud of you. Thank you.